Hey guys, so this is going to be my birth blog at the same time Santino's NICU stay. So yep, he ended up at the NICU. So let me tell you the story of what happened. So today is actually my first day after my surgery. So today is January 6th of 2026 and it is at 5:55 a.m. in the morning. So like I said, this is officially my day one after surgery. Um, Everything happened so quick. So January 4th, which is a Sunday, I just woke up with not pressure or anything, but I just feel something is different. I mean, we know our body more than anybody else, so I will always advocate that to anybody that are pregnant to listen to your body, listen to all the signs that your child or your baby is giving you. I mean, no one can feel that than anybody else, but it's you as a mother. So I have been listening to all the symptoms that my baby was giving me in that day. So, Santino has been a very, I don't know, he is just so different. Like comparing it to my first pregnancy, Santino always gave us so much anxiety the entire pregnancy. Me having an anterior placenta, it was so hard because it took him a while, or I mean, he's probably moving inside, but since he has that anterior placenta, or I do have that anterior placenta, it took me probably until 24 weeks that I can fully feel him. And then he goes days that he is active, and then he's gonna stop moving again. So we have few trips at the ER just to make sure if he's okay. So here comes Monday, January 4th. Since I'm on my third trimester, I'm on 35 weeks. He was just like moving a lot, but it's more on pushing out, it's more on pressure, and it's always on my right side. And then it will take my breath away. And I'm just like, okay. Well, like I said, he has been doing that for the entire third trimester. But that day, it was just kind of feel different, if you know what I meant. And I would just keep observing it. But around afternoon, like 1:30, he has been doing the exact same thing. And I feel more pressure down in my, like, in my old incision scar area, so below my belly button. And the interval of the pain that I was feeling was literally a textbook definition of me having a preterm labor. So the interval was every 5 minutes, and then I can feel the pain for probably 30 seconds to a minute. And that has been going on from 1:30 all throughout like 3:30 p.m. And I have a index card that I wrote it down so I can keep track of everything. And I was like, okay, this is very different. I mean, there was no bleeding, there was no fluid or anything, no discharge. It was just that the interval, the frequency of the pain I was feeling, it was just different than the normal days. So me and Jordan, gladly that day, Jordan actually came home early from work, and we were just, I mean, we were like, okay, should we go? Should we not go? What is going on? So we did call the OB office, which is, they were closed because it was a Sunday, and there was a on-call nurse, and that's what she said, just listen to your body. And since you guys live farther away, you gotta decide it as soon as possible. You don't want to wait if you really have to go. So that was around 4 o'clock when we called. I mean, it did stop. There was a period of probably like an hour that the interval of the pressure, pain, and all of that went away. So we waited, but here comes 5 o'clock. He started it again. It was not as close as when it started, like 1:30, but it was there. So me and Jordan was like, okay, nope, let's go. So luckily, I already packed my hospital bags and my baby. I mean, it was not complete, but most of the basic stuff that you have to bring, I already have it in my bag. So I was good to go with that. I was just finishing up labeling stuff, especially for the baby stuff. So after I did that, I kind of wash up and I was like, all right, let's go. We called my in-laws so they can take care of the dogs, obviously, because we have three dogs. So we did that and we hopped on the highway, drove to Parkview, and that was the start of it. I think we got to the hospital probably around 6:15, 6:30 that evening, and yeah, I was contracting for sure. Like the monitor was showing I was contracting, and they were observing me for probably an hour or two, just to see how is he doing in there. But surprisingly, Santino was actually doing great. Like his vitals were great. His heartbeat was very good. My sugar, when they did the testing and everything like that, it was elevated. It was actually higher or highest level of sugar I have. I think it's because I just ate too. I mean, it's after holiday, we got plenty of leftover and all of that. So, that's what it was actually concerning for them. They asked me if I have diabetes or all of that stuff, but I was like, no, I mean, I passed my glucose testing and all of that, so I really didn't have that issue to begin with. And after all of the testing and all the observation, they just decided, and that was around probably midnight, close to midnight, when they decided to just keep me admitted so that they can monitor me overnight. That could They gave me IV fluids just because that could help with the contraction, because I was still showing like it's not considered as active labor because it was not consistently in like 2 or 5 minutes apart, but I'm still showing the contraction between 7 and 9 minutes. All right, so let's continue. My pumping alarm just went off, so I have to take care of that. And yeah, I'm starting to pump just to start stimulate my milk production. Sorry. So I think we were talking about 12 midnight. So around 12 midnight, they already decided that they want me to get admitted. We live pretty much like 40-45 minutes away from this hospital. So that's why they said, no, we're just going to keep you in here so that we can closely monitor you. So before they decided to do that, they already checked my cervix. Of course, that was one of the first thing they did on top of doing blood works and all of that. So cervix was still closed, which is we are very glad that it's still closed. If you guys didn't know that, after the year that I gave birth with Mateo, they told us one of the reason of him coming out early is I have an incompetent cervix. So from that moment, that year, we actually went through a lot of meeting physicians just to kind of like dig down or dig deeper of the cause of it. And I ended up having, so that was October 2023, that I ended up having a transabdominal cerclage. There are different kinds of cerclage. You can actually have a cerclage put in while you are pregnant, but in my case, it was put in prior to pregnancy and stuff. So it's called transabdominal cerclage, which is a permanent cerclage put in your cervix to help not having a very early labor, or making sure baby will be up there and not coming out. So I think me having that cerclage helped tremendously. Like if I did not have that cerclage put in, who knows? Santino probably is out here like early gestational age, but I'm so glad we made it to 35 weeks, which is a higher chance of him, survival wise and organs being developed well and all of that. So we were very thankful for that cerclage. So after that, the IV put in, they gave me medication to kind of like help my uterus calm down a little bit. And even after all of that, I was still showing contraction. Like I said, it was not an active labor, but it's still there. So that kind of worries them because the more contraction, that puts too much pressure into my uterus, and that could affect my cerclage. Or they are really worried about uterine abruption. So they don't want that to happen. It would be very risky. So they were like, okay, you're at 35 weeks. Baby should, be okay. And we'll just do this. So I got admitted in the room, and then they were still telling me like there is a chance that you are gonna deliver like early. It's either like past midnight or anything that's still on the table, but we will see how you are feeling, how your contraction after all this medication, and if this will all help. But we are still gonna talk about this with your OB in the morning and see what will happen. So all of that are there. They communicated very well with us, which is we appreciate that. Communication is very important, and all of the doctors, the staff were great about that. And after all of that medication and stuff, it's still showing contraction, and it was actually getting worse and worse. I mean, after all of that, there was like a period that I wasn't having contraction for like half an hour or stuff like that. But later on, I was starting having it again, like close to like 5 minutes, 7 minutes, stuff like that. So, yep, when the nurse came back, and that was, I don't know, I can't remember the time, but that was 12 something. And she's like, we're doing it. She came in and she already have a, like, changed into like a surgery outfit. She's like, we're doing it tonight. So she already got gown for Jordan, gown for me to change, and all of that. They were already preparing for medication and all of that. I mean, gladly. So since we got there, um, backtrack. January 4th at 1:30 was the last meal I had. So, I mean, I'm good because now this is already past midnight. So this is already January 5th. So I'm good. If we're gonna have a surgery, I'm good. There's no more food for the last 12 hours and stuff like that. And after all of that happened, it was pretty quick. I mean, it was quick, but it is very calm at the same time. Everything was organized, like well communicated. The funniest part was Jordan, before we decided, or before they decided we're gonna have my C-section, he hasn't been sleeping for a while. He got up so early. He was probably been up for 26 hours by that time. So he went out, grabbed a meal to eat, and he took a NyQuil. Yeah, so he did took a NyQuil. So, if you guys know what's a NyQuil here in America, that is like you want to, like, if you're sick and stuff like that, you take that, and then you're gonna be snoozing and you're gonna be tired and all of that. So he was very tired, on top of trying to like go through all the C-section process and all of that. So at exactly 1:22 a.m., our son Santino David Chambers was born. And it was just it was very quick actually. From the time that they put the blue cover between me and the doctors that were doing the surgery, I think that only took them an hour. This is not including the like them giving me a spinal blockage, or I think that's what it called, spinal block, that's what they call it. So that is not including to that. I'm just talking about from the time that they put that blue cover between me and the surgeon and start the process of cutting me open and sewing me back up. That only took like pretty much an hour and 10 minutes. So they did pretty good. And Santino, from the time that they cut me open and then pull him out, probably 5-10 minutes. So it was a very quick procedure. I mean, the tagging, pulling pressure, you will feel it. I felt it so bad that I could feel it. Like, Jordan is right next to me. I was holding his hand and I'm literally like bouncing while they're tagging and pulling and all of that. I mean, it was not, you can't feel the sharp pain and think that they don't want you to feel that. That's why they want to make sure that before they do all of that, they want to make sure that your the spinal block is working, because that is very dangerous if you feel the pain. But the tugging and pulling, oh my goodness, it was ridiculous. But it was all good. So he came out screaming, and Jordan said he has this feast and his face was just like mad. And but yeah, so we were glad that everything went well. But the problem was Santino had a hard time. We did not, so I have all this birth plan. I know it was like a C-section, emergency C-section, but like I said, they communicated very well. I advocate for myself. I tell them what I want, but to the extent of baby safety and my safety will be priority. So what I told them is I would like to have a skin to skin. I would like to have a delay cord cutting or clamping, which is they did that too, but it was probably just like a minute or something because Santino is having a hard time breathing. His oxygen level is not in the level where they want them to be, so we did not do a skin to skin because I mean there's no way. They have to like work on him immediately. I did had a glance because they kind of brought him like to my side and that's it, and then there's like we have to put him on the table. So while they're doing that, but he cried so good, like he cried and cried and cried, which is makes me feel comfortable. But it's just like, you know, he just needed a little bit of help, so they called the NICU nurses, NICU doctor, to kind of assess him, and they decided that he needs to go up to the NICU room so they can assess him more, put some CPAP and all, like whatever they need to do, since they have all the equipment in the NICU department. So yeah, so while they're stitching me back up, Jordan is pretty much with Santino, and then when they decided that they have to bring Santino up, Jordan stayed with me up until they sewed me back up, which is that took a little bit more time. And they have the baby up there, so by that time I don't really know what was going on, but my thought was Santino is 35 weeks. He is way older than Mateo. I heard him cry so loud, and the nurses and doctors are very reassuring that he will be fine. And you know, like I was like, whatever it takes, take him, and I will focus on myself as well, since I'm still laying there in the bed and they still stitching me back up. So yeah, so after everything was done, you know, they talked to me what happened and all of that. Because even though they were there, they were talking to me while they're like doing the surgery and stuff, but they're more on focusing on making sure the baby's out safe, doing what they need to do and all of that. They told me that I really have less scar tissue from the circlage that was put in, and that actually very surprising for them. And then I did have a previous C-section from Mateo as well. So to make the story short, they were just trying to tell me that I was healed up pretty good, which is very good. That's why they did not have a hard time cutting me open and working around the scar tissue stuff, because there's not much at all. And after the surgery, I have to be in the post-operation room, which I was there for 2 hours just to kind of like observe how I feel before they take me to the postpartum room. And I mean, that's where I'm at right now. And when that time, the communication from the NICU and my nurses, we go back and forth, you know, they making sure we know what's going on with Santino. Santino was doing great in there. He was in the CPAP machine, just kind of help him boost. I mean, he's still doing all the breathing and all of that. It's not something that he was in ventilator or anything. It was just a CPAP machine that will help him breathe. He's doing all the breathing, but it's just like a little push, because going through C-section, aside from mama having all the pain and trauma, baby is also very affected with that. Just the fact that, you know, they're not gonna go through the birth canal. You think about it, like when they do that, that's like slowly, but when they do like the C-section, and you have water fluids everywhere in there, so they can inhale that water in them. So that's actually what's going on right now. So like I said, he was in the NICU, and now I'm at the postpartum. Jordan actually is at the NICU most of the time. He actually sleep there. So today is, I'm just gonna repeat this. So today is January 6th. It's already 6:20 right now in the morning. Day one. Jordan is upstairs. He stayed up there all night. And fortunately, Santino is still having a hard time, but still okay. Like, I'm trying to be calm, but I mean, it's scary. All the trauma will always come back of what happened to Mateo being in the NICU. But you know, what can we do? We just have to believe, we just have to pray, we just have to trust them. But at the same time, we are on top of everything. We asked so many questions, and apparently they did a x-ray in his lungs, and there was a little fluid excuse me, there was a little fluid that was in his lungs. So they just need to increase his CPAP level. He has been on like in the 20s level in the CPAP for his CPAP machine, and he's actually good. They want to see his oxygen level between the 90, 95, something like that. But he cannot maintain it. Santino can't maintain it. He always drop and drop. So now that they found out that there's a fluid in his lungs, they had to up the CPAP machine to 40, and he's actually doing great, but they don't want to see that CPAP machine at 40. Hopefully by today they can decrease it to the regular like 25, 27 level of the CPAP. But at the same time, Santino needs to make sure that he can consistently maintain that good level of oxygen as well when they decrease it. Because if not, there is a chance that they have to do like a tube that they have to put in his lungs to kind of help release that fluid, which is hopefully not. So I'm praying that they're not gonna end up doing that, and Santino can just power this through and be strong and breathe on his own. I believe in my son. He is very strong nugget. So let's talk about my recovery. So like I said, today is day one. Today is day one from surgery. Yesterday was actually, since it happened super early, I really didn't get time to rest. Like, my adrenaline was so high, my heart rate was still so high, and I'm still in all kinds of medication, like pain meds. So I feel like my body, even though my body is so tired, my body's still in shock that it's like fighting. So I really didn't get any rest yesterday all throughout after the surgery. But surprisingly, my body, I'm proud about myself, and I'm proud of my body because it can handle surgery very good. Yesterday I was already like walking around. I was, like I said, I was already going up to see Santino, and I had a skin to skin with him. It was really good. We have some videos of that we'll include. And yeah, I feel like seeing him gives me more energy and just that positivity that, mama, you gotta be strong, you have a baby. And of course, having Jordan with me, I can't ask for a better partner. He has been Jordan will always be Maori, just like me, but we give each other a hard time. But dude, I cannot live without that guy. He has been amazing. I know from the get-go that he will be the best dad. He will be the best father and provider for us. So, and he's doing good. He is a super daddy. So, in my recovery today, day one, actually, I woke up. I was thinking last night before going to bed that I will be up every 3 hours to stimulate my milk. But guess what? I just pumped until like 9 o'clock, and then the 3 o'clock, my alarm went off, and I just literally canceled it. My body was just exhausted. My body just need to just rest. So I did pump, honestly. So around that time, like 3 o'clock, when I got up, turned off my alarm, I was actually feeling a lot more pressure, a lot more pain around my incision area. So I'm feeling more pain than yesterday, which is very normal because your medicine is wearing off everything. So right now your body was like, oh, you just had a major surgery. But for some reason, Jordan actually asked me yesterday if I was okay. And I said, why? He was like, you don't look like you just had a major surgery, because I'm moving around great. I haven't had a full shower, but today is the day that I'm gonna go take a shower so I can clean up, change into my PJ, and not in this hospital gown. So far this morning, like I said, when I got up, I felt bad. Like, they asked me about my pain ratings, and when I was getting up, I gave them 7. But dude, when I like stood up and walked to the bathroom, I literally asked for a nurse hand if she can help me, because that pressure was just so painful. But I had to pee though. So that pressure is actually, the pee pressure is actually pushing the uterus. You imagine it, your uterus is literally like big still. So yes, it's swollen, it's inflamed. So all the pressure is not gonna be good. So after peeing, that helps tremendous. That helps really good. So now I can take 3 kinds of pain meds if I have to. But you're talking to me. I don't like taking as much medication if I don't have to. But I always listen to my body. So I did take ibuprofen and oxycodone. So hopefully today's a good day, and I cannot wait to go upstairs and see Santino. So I think that's it for the story, and I'm just gonna keep adding clips and videos in here all along up until the time that Santino can be released. We don't know how long he's gonna be in the NICU, but they're gonna keep him there for as long as, you know, he's all good to go. And that would be a peace of mind as well. Like, I don't want to bring a baby if he's still having a hard time to breathe. Like, we'll do the sacrifice to be up here with him. Jordan is gonna be off for a while, which is great. That has been a plan, and he has been working so much hours just to save up for him not being at work for at least a month, to help me take care of Santino, and of course help me too to recover at the same time. You know, that's gonna be a lot for everyone, but it is what it is. We are a family of 3. We have been praying for this. I don't know, we are beyond blessed. We know that all through this journey, we know that Mateo is with us. And it's honestly, it's so hard to see Santino to be the NICU up there. All the emotion, all the trauma, all the flashback. It was just hard. But we gotta tough it up. We just have to believe. We just have to surrender everything to God. And that's what keep us going. So, yes, we got this. We are blessed. And we have so much people that loved us. We have a very good experience here so far. Like I said, this is our day 1. So I can say that we have a very good experience, but who knows what's the following days. But right now, I will stick to that. Great experience with Santino's doctors, Santino's nurses, my surgeon, my nurses, and all the physicians here. They were all great. So yeah, I cannot wait to finish all this documentation. I mean, like I said, if you don't like it, it's fine. It's pretty much for me to look back and rewatch, and with Santino. Santino will be watching this. So I will talk to you guys later, and see ya. So this time we were just in the room getting monitored with the heartbeat of the baby. Around this time, we did not have any clue that the baby is gonna be here very soon. That time they just want to make sure to see if baby is good, heart rate is good. But my contraction really did not stop. It wasn't an active labor, but it was there. Uh,
Hopefully we don't have to use that today.
Tonight. uh, Still hooking the monitor.
No, for a second, I'm like, I went the wrong direction with it.
And then I did.
And there he is, January 5th, 2026 at 1:22 a.m. Santino David Chamber is born. Hello. Baby is out. He was out at 1:22 a.m.
6 pounds, 1 ounce.
1 ounces.
He's good size for how early he came out.
January 5th. He is actually up in the NICU right now. They're just trying to make sure that his oxygen is all good, but so far he's doing good. So right now I'm just in the post operation room, so I'll stay here for a couple hours, then we'll see, and we can probably go up and see the baby. Everything went well. Thank you, Jesus.
Yep.
So it's been, I think, 2 hours after my surgery. I actually can start lifting my legs, my toes, and the feet still not. I can't still feel them, but at least I can move my legs a little bit. And I'm having some high blood pressure. It's so hot in this room anyway. So yeah, and we are just waiting until probably 4:15, and they are going to take me to the postpartum room. And after that, when we get all situated, we can go to the NICU and see the baby. So I can't wait for that.
Girl, get it.
Short.
So
Get it,
me
girl.
pressing that button means baby is born. I did that when I was on the way to the postpartum room, which is 2 hours after the surgery, and it will play the music in the hallway and everyone can hear it. I didn't know that. We did do that too, Mateo. I mean,
You did something similar.
we did. Oh yeah, you write the name on the board. Something.
What would be best way? Head that way or feet?
He's snoozing.
I think.
Good look.
He's crying. You silly?
It's me, man.
It's
I
Dad.
I know you know the voice. Because you used to go kick in the belly every time I talk to you.
He's going to baby. Dia. You're gonna sleep with the baby boy.
I'm sleeping in the room.
Alright.
I'm going to be snoring.
Alright, see ya.
Love you.
Love you. Then I will stay here and try to get as much rest as I can, which is kind of been hard. So we'll see. All right, 1, 2, 3, up. Yes. That time it took me a while to get up. I mean, I just had a major surgery. I know people will say C-section is an easy way out of giving birth, but I don't think so. Even if it's a C-section or a normal delivery, our body went through a lot of trauma. It's still the same thing. You give birth. So for all the C-section mama out there, we did a good job.
That little mouse pushing on his face.
I know.
No, you're fine. We can see.
Yeah,
We're just,
good.
There you go. You can see his entire.
I'm like hiding. You get out of your picture. I don't want to ruin it.
Look at those toes. Look at those big monkey.
So, day 1 after surgery and go time for shower. Towels, all of that's there, and we're gonna shower. We'll do this. Okay, thank you, sir. And we are going. Don't you? Oh, that first shower feels so good. Thanks to Jordan, he did help me. But nothing like having that first shower. Actually, I still got baby balm. I mean, it's day 1. Thank you. So we are gonna go down to the cafeteria and grab us some food.
I understand.
Maybe not the most appropriate explanation, but people understand what I say about it.
He's moving his fingers.
Oh, yeah. See, it's up to 97, so I'm actually going to go down on his oxygen a little bit.
Okay.
He's enjoying mom.
He loves Mama. I think you just look like Mama. I think your mom is twin.
So today is January 7th and it's close to 5 p.m. This is technically our day 2 here at the hospital. Santina's day 2 at the NICU as well. So last night it was kind of crazy. I actually didn't get enough sleep or rest, but it was fine. I was up all night at Santina's room, and today actually is the first time that I had a full 3 hours straight sleep, which is better than nothing. And what else? I'm actually getting ready, almost done, so I can go back up to Santina's room. Jordan is there, and like I said, he's still having a hard time breathing, but we're hoping for the best. He is actually showing a lot of progress of peeing, pooping, which is good, since they found that there was a fluid in his lungs, which is part of, I mean, a lot of infant or newborn that is born prematurely through C-section, it's normal to have trauma, and you know, just try to figure out how to help them out with that. So one of that is Santina's having a hard time with his oxygen level, so he needs help with that one. Found the fluids in his lungs, so they're working on that. But great news is he's pooping, he's peeing, so he's getting all that fluids out as much as possible. But he's little, he's a 35 weeker and 6 pounds, but I mean, they said that that's a good size anyway. But he's looking great, so we're aiming for the best. They did a lot of lab work today with him. Blood work, they did echo, they did x-ray. What else? They did like an scope on his mouth, throat, and all of that, just to check if everything is okay, since those are all involved with breathing. So far the blood work came back all good, so we're just gonna wait for the blood culture result, and what else, and the result for the echo, and what else, I'm thinking. Jordan is actually the one who's more informed of what's going on with Santino, because he's more up there, since I was just sleeping here this afternoon. But I'm actually gonna go up right now, since they do 3 assessment every like in the morning, or like the day, and then at night as well, every 3 hours. So it's almost 5 o'clock in the afternoon, so I had to go there so that I can be there by the time that they do the assessment. Usually doctor will be there, so if you have questions, all of that, that's when the time that they have to change the CPAP, change Santino, clean him up, clean diapers, see how much peed he did, all of that, feed him, and all of that. So yeah, so we're just praying for the best. It's just a little hiccup along the road, but we are happy that he's out here, that we can see him, and it looks like he's improving, but it just takes some time. So thank you. Here's Mama's milk right there. Just gonna swab it around the lippy. Oh my goodness. How about right here? You like that? Oh. How about here? Day 3 in the hospital, so right now we're just trying to gather all our stuff since we're about to leave the hospital, since I'm getting discharged. So making sure we're not leaving any of our personal belongings in the room. It takes some time to gather everything. Hello. So today is January 8th, and today is technically our day 3 here in the hospital. Santino's still in the hospital, but Mama is getting discharged. So
we are now going to figure out if we're going to stay at the Donald McRonald house.
Yeah, so we'll see. So they do provide, like, not for everyone, but they do have this facility downstairs, which they have hotel rooms, and it's like a house where you can stay if you have a baby admitted in the NICU. So we'll see if we can get in and get a room. It
Probably not though, so we'll probably be headed to a Hampton or some stuff.
He has his name, but yeah.
Just
so
blur that out.
So we are looking forward for the day that Santino is going home with us, but we don't know yet. But for now, we are just praying that he can keep going and we go in the right direction. That's the only thing we can do right now, is just believe, trust, prayer that God will guide us and God will answer all our prayers. So we'll see you later. Hey guys, so finally I'm discharged from the hospital. So right now we are staying in a hotel. I know we mentioned about the facility in campus where we can stay there while Santino is in the NICU, but unfortunately they don't have any room available. So they did help us check in into this hotel. So we will be here until there will be a room available. So this will be the end of this video, but I will continue documenting Santino's NICU journey, and I will post that here in my YouTube channel as well. It's not because I would like to show it to everyone, but it's mainly for me to go back and rewatch the journey that we've been through. This has been a long journey for us to have a baby, and I mean, I've been very vocal about our history and all of that. So I just pray to God that everything will be okay. So, and I believe that because I surrender everything. So thank you so much, and I will see you in my next video.